Hello, everyone. My name is Tuan Nguyen, and I'm a senior informatics consultant at CISO. I've been working in the laboratory informatics space for the past 20 years. I started out my career as a lab analyst and then moving into LIMS support development and currently providing consultant services for LIMS. I have extensive experience around the laboratory workflows and very good in understanding the laboratory processes in various industries, especially manufacturing, foods, clinical, and public health. My current focus right now is doing STARLIMS development and software data management information system, SDMS. Data innovation that allow the instrument integration with STARLIMS and is powered by Airpod. My hobby, I love fishing and gardening. So just a quick overview of CISO and our services. We specialize in North American consultancies. Our focus is solely on the laboratory informatics. Our consultants are very experienced in laboratory backgrounds. We offer services to support LIMS strategy, implementation, and validation. As a partner of Airpod Informatics, we are able to ensure our excellent services for our customer. So now I'll pass it to Carlos to give us an introduction of herself and an overview of today's agenda. Carla?
Thank you, Tuan. Hi, everyone. Very happy to be with all of you during this webinar. Carla Paulsen. I've been with STARLIMS for almost 20 years, with the last 10 being about informatics. I have been involved in numerous LIMS implementations for public health and clinical laboratories mainly. I've been under various roles, business analyst, project manager, product analyst, and now I'm the senior product manager for the STARLIMS Life Sciences solution. I have my MBA and also a certificate in biomedical informatics. Also, I'm PMP certified, and my background is on computer science and software development. And then during my spare time, I'm a busy mom of a 10-year-old boy. I enjoy working out and playing tennis. So a quick overview of STARLIMS, about informatics overview. So you probably have heard of STARLIMS, that's the brand name, and originally STARLIMS was founded in 1986. It was acquired by Abbott in 2010, and it became Abbott Informatics Division, with STARLIMS being the primary solution product suite. So STARLIMS integrated solution is actually a combination of different Abbott Informatics products, but always having the LIMS as the centerpiece. So all of these other products or solutions are SDMS, ELN, Advanced Analytics, and mobile solutions. So for today, the agenda of our webinar is going to start with the business needs of this implementation that we did in partnership with CISO. I'm going to go over specifically in the process of sample reception, aliquoting, storage, and testing. Then I will explain about the clinical studies, the concept of this aliquoting plan specifications that were required for this customer. Then Tuan is going to go over the solution of the batch aliquoting that was implemented, also going over the sample storage and distribution for testing. So this will be all part of the overall workflow solution. And at the end, Tuan will also cover the instrument interface implemented as part of this implementation with BioMicroLab. So let's start with the business needs of this implementation. So just to give you a little bit of background about this customer. So this is a biopharmaceutical organization. This laboratory does testing and provides services to the various clinical trials, clinical studies that they perform, and they have to receive samples from multiple studies on a daily basis. So there is a central lab reception area that takes care of that. So first thing that we have is that these samples, they arrive with a requisition form that has the information of the clinical study, the visit, the subject, so a lot of information regarding the sample that that has arrived to the lab that needs to be received. So these samples are received, and once they are received, they are loaded in this instrument, BioMicroLab. What BioMicroLab does is basically checking the weight, the volume of the samples, and it will provide the information of the sample volume for each of these samples. We will have this integration as part of the solution with the STARLIMS so that this sample volume can be captured. So imagine now we have knowledge of the samples that arrived, and now we know also the volume of each of the samples that arrived. Now, the next thing that this team in the central lab reception area, what they typically have to do is looking at the different clinical studies, because these samples could be coming from multiple studies, and each of these studies have different protocols. There is this concept of aliquot plan. So they will typically batch and group the samples for, let's say, the same clinical study and visit, so that they can take a look at this aliquoting plan and follow that aliquoting plan for that group of samples. They will manually do this aliquoting according to that plan, and once they complete that, there could be some samples remaining from the parent samples. And so if that's the case, those will need to be stored. And also for the aliquots that have been prepared, they will need to also be stored. Once they are completed with all of this storage, the next thing is going to be the transferring or distribution of these aliquots to the different testing groups. And so this is something that we also need to take care of, because we have to make sure that we capture that whole chain of custody of the samples. So the aliquots were created, the aliquots were stored, and then the aliquots eventually are picked up by, let's say, user John Doe from testing group A. So doing all of this manually, and especially when you have to handle high sample volume, can be a very daunting experience when you have, so many samples that you need to aliquot. So that is where we come, and we have to now not only understand, see what is the whole process the business needs, and see how can we address this with the STARLIMS implementation. So for that, first of all, I want to go over the whole concept of the STARLIMS clinical trials. We have a trial manager solution in our system that basically will help with this whole process, because part of the clinical study is typical that we have to take care of specifications depending on the study protocol, such as the study schedule. And the schedule is typically composed of these time points or visits, or also bit numbers. So this is going to be, based on the protocol. For example, a study can have, let's say, 5 visits from these patients. And we will also know what kind of samples are expected to be collected and sent to the lab. So things like the specimen type, the container type, we will know that. So for instance, in visit number 1, we're expecting to get blood sample or plasma sample or serum sample, etc. So we also, need to be able to capture that as part of the schedule of the study. But also there is this concept of test panels, because many times we not only receive just the samples to, let's say, be stored, but we need to perform testing on these samples. So it could be one or it could be multiple tests. So that's something that we already have